Good evening, everyone, and welcome to our Davis and Henley College of Nursing Admitted Student Chat. It is my pleasure to welcome you here this evening. My name is Pam Pillow. I'm the Executive Director for Undergraduate Admissions here at Sacred Heart University. Sacred Heart received our record number of applications for fall 2021. We are just so proud to have reviewed and considered your applications to our Davis and Henley College of Nursing. You make up the most qualified group of applicants in our history. On average, you have a 3.7 high school GPA. You've taken rigorous honors, AP, IB curriculums for your consideration. So it is truly our pleasure to chat with you this evening and make sure we get all of your questions answered. As you try to make your decision, as we approach May 1, our deposit deadline for where you will call the next 4 years your home. It is my pleasure to introduce the Dean of the Davis and Henley College of Nursing, Dr. Dean Donius, for her welcome. Thank you.
Thank you, Pam. And good evening. Welcome and a very hearty congratulations. As you heard, admission to the Davis and Henley College of Nursing is highly competitive. So you are among the best of the best. As the Dean, I'm pleased you're here so that we have an opportunity to tell you why we believe Sacred Heart University and the Davis and Henley College of Nursing are such special places to learn and grow, and why we at the College of Nursing are the best of the best. Here you will be part of a university that values you as a person and the gifts and talents you bring to us. Here you will be part of a college that values the essence of nursing as caring with compassion, empathy, altruism, with the intention of healing body, mind, spirit. And here you will be part of a nursing program that values the role of the professional nurse as clinician and advocate for the good of patients, families, communities, and the healthcare system in the context of social justice in a global society. Today you'll meet our program director, Dr. Ferrillo, who will describe our program in detail and the opportunities it brings for our students. And you will have an opportunity to visit virtually our outstanding skills and simulation facilities. At the end of this presentation, you will come to know the uniqueness of who we are and what we offer, and why I believe and am so proud to say we are the Sacred Heart of Nursing. Again, congratulations and welcome. I hope you choose to join the freshman class of 2025 at SHU. Thank you.
Thank you, Dr. Donius. As Dr. Donius explained, we are going to start this evening's chat with a brief presentation from our program director, Dr. Heather Ferrillo, about our Davis and Henley College of Nursing first professional degree in nursing, which you are all admitted to. At this time, I'll introduce Dr. Ferrillo. Thank you.
Thank you, Pam. Congratulations to everybody. It's such an exciting time to be entering nursing, and I really commend you on that decision to become a nurse and to start your journey, hopefully here at Sacred Heart University in the College of Nursing. So I'd just like to share a little bit of information about the program. So why choose SHU? So I'm sure you've looked at many colleges, many universities with amazing programs, but why choose SHU? Well, one of the things is our excellent NCLEX pass rate. So we have a pass rate of 96% in May of 2019, and we're trending to be 99% for our 2020 May graduates. We have small class sizes of approximately 30 in class, approximately 8 in lab, and also 8 in clinical. So those are small class sizes so that our faculty can get to know you as a person and as a student. We use high impact teaching strategies in order to facilitate not only that great NCLEX pass rate, but also safe patient care. So we use a lot of these things in our classes and in our simulation, which I'll talk about in a minute. We provide student support. So from freshman year on to senior year, we have student support both at the university level, at the college level. We have dedicated freshman advisors to help freshmen to make that transition into college from high school. And these are nursing advisors. These are nursing faculty. We have tutors. We have classroom learning assistants. We have one-on-one time with your faculty. So we provide that for you. A couple of highlights from our freshman year. So as you move into your freshman year, we'd like to get you assimilated into the College of Nursing as quickly as you'd like to be. We have a very robust SNA, which is the Student Nurse Association, and freshmen can join the SNA and become assimilated into the College of Nursing with our upperclassmen students. Again, we have nursing academic advisors that are dedicated to the freshman students. We have a peer mentor program. Our peer mentors are upperclassmen students who you'll be paired up with, who really act as a mentor to you throughout your program, especially freshman and sophomore year. They also provide opportunities for learning about some of the classes that you'll be taking and how to be successful. Usually every semester, they give a couple presentations on how to be successful in those courses that semester. We also have collaborative faculty. So we collaborate with all of your faculty for your freshman classes, because those classes are very instrumental in getting you where you need to be for your nursing classes. Another important part and a special part of Sacred Heart University is our Catholic intellectual tradition. We have every fall a blessing of the hands ceremony for our junior nursing students and senior nursing students who are headed into clinical, and your family can join. And we bless the hands, and you can see the pictures here of the students having their hands blessed by faculty as they're preparing to go in and care for our patients. We've also extended this blessing of the hands to all of our abroad experiences, including our SHU and Dingle campus in Kingston, Jamaica, in Ghana. Wherever we care for patients, we have our hands blessed, really including the culture of that country as well. We say nursing prayers before exams, and that prayer is there to just get you centered and grounded and ready to focus on your exams. We also have a very strong faith-based nursing program if you'd like to get involved in that, which includes a lot of community service. So just a little bit about our curriculum. Our liberal arts and Catholic intellectual traditions are grounded in the curriculum, and we integrate those concepts into the nursing courses. All of the foundational courses are then scaffolded into our nursing courses as well. For example, our math course that is linked into our pharmacology course, and your microbiology course that you take that then leads into your nursing pathophysiology course. So we work really closely with those other disciplines in order to have a seamless curriculum. We also have a seamless curriculum for study abroad and global clinical placements. So if you'd like to study abroad, I'll talk in a couple minutes about a couple opportunities that allow you to study abroad for a semester or even short term without any loss of time in your plan of study. Our nursing courses, which start sophomore year, have a combination of on-ground and blended courses. So our on-ground courses, a typical lab and clinical-based courses, they're usually taught in block classes, which is a 3-hour class per week, meets once per week, which allows ample time for you to have your lab and your simulation and your clinical on separate days. We also have some courses that are blended, which means that maybe one week you'll be on ground and the next week you'll be asynchronously online, and with a variety of engaging learning activities. All of our exams are given on ground in all of the blended courses. We also have 2 exciting courses in your senior year that gets you ready to move into the nursing workforce. One of them being the Senior Synthesis course, which provides not only NCLEX preparation, but preparation for you as you're entering your first professional role. Each student in this course works with their course faculty to develop an individualized plan to prepare you to be successful on your NCLEX exam. We also have our capstone course senior year, which is a clinically based immersion program. And this is designed to strengthen your critical thinking, support your clinical judgment, and really integrate you into that clinical placement. And this is where you have some opportunity to have some say in the areas that you potentially want to work in and maybe experience your capstone in that. Just a little bit about our simulation suite. So we have a simulation suite which includes 8 specialty simulation labs, 4 debriefing rooms. Simulation starts junior year when you move into your clinical courses. And you can see that we can provide really whatever we can get in the clinical setting, we can provide in the simulated area. And simulation provides a safe area for you to learn about some of these concepts that you'll see in clinical. We have, as you can see in the center, we have Victoria, and she gives birth. We have 3G simulation man who can act as a patient would. He reacts to medications that are given to him. He also can sweat. He can cough. He can really, we can really program him to respond as if a patient would. So this is integrated into all of our clinical courses so that we can provide clinical experiences that you may not see in the clinical area, because we can't always predict what you're going to see in the clinical area, but we know you're going to see it in simulation. We have a variety of clinical sites. Where we are located in Connecticut is really ripe for clinical sites. We have some amazing hospital systems in this area: Yale, New Haven Health System. We have Hartford Health System in this area. And so we really have a variety of sites that we can use, also from community all the way up to, level 1 trauma hospitals that we use for clinical. We also have a lot of outpatient sites, community health sites, school districts, and we really provide a very broad range of clinical sites. So our study abroad opportunities. So we have a lot of exciting study abroad opportunities, and we are resuming our Dingle program starting in winter. So we're very excited to be going back to study abroad, which has been on just a slight pause. We do provide seamless plan of study, including clinical experiences. There is an application process, so it's important to keep a strong academic and professional standing. But we do have 2 opportunities that allows you to go abroad for a whole semester without losing your place in your plan of study. So for sophomore year, you can study abroad spring semester. You'll do your first clinical, which students do that semester here in an Irish hospital. There's weekend excursions. You'll take 2 nursing required courses, the same courses the students here will be taking with our faculty. And Irish faculty. We also have core foundational courses that are given through an Irish lens. And this is on our SHU campus in Dingle, which is an amazing little town in Ireland, and where our campus is located. We also have an opportunity for June fall semester in Fremantle, Australia. This is a little bit different. Your courses will be taken at the University of Notre Dame. And there's 3 nursing required courses. And then you come back and you have a 5-day stateside clinical and simulation residency upon return. If you don't want to go for a whole semester, we have several opportunities in Dingle to do a 2-week immersion program. And what we have the nursing leadership course, which is a senior level course. We provide that in May prior to your senior year, so it lightens your load senior year. And it's a 2-week immersion with some clinical as well involved in that. So you get to do a little bit of clinical a day or 2 in an Irish healthcare setting. When we look at a comparative analysis, professional trends and issues, and looking at both Irish and the U.S. perspective. In addition, we also have clinical field experiences. We offer clinical field experiences for clinical hours. So you may travel for a week to 10 days to one of the countries or to Central Appalachia in Virginia, where we provide care for the patients in those countries. Our students are not only nursing students. They get involved all over the university. You'll see our nursing students everywhere. We have students in the honors program. We have students in the ROTC program. Again, the Student Nurses Association. Many of our students are committed to service learning and volunteering. They are work studies both in nursing and in other areas of the university. We have many Division I student athletes. So if you are a Division I athlete, we do work closely with athletics to ensure that you are able to still be a nursing student. We have students in clubs, work as classroom learning assistants, and many students hold offices in sororities, fraternities, and on the university. So these are just some pictures of some of the things that our students get involved in. Another exciting opportunity that you will have is a Susan D. Flint Oncology Nursing Fellowship Program. This is for a rising senior, and it's a summer oncology fellowship that's awarded to a rising senior interested in pursuing oncology, and it's a unique educational opportunity sponsored by Frederick Flynn in memory of his wife. And students get the opportunity to work in oncology and then even pursue a career in oncology if that's something that they prefer. So you'll find our graduates everywhere. So our graduates are not only on the East Coast, we have graduates as far as California. We have graduates that are down south. We have students that go to Vanderbilt several students every year that go to do the Vanderbilt residency in Nashville. So really you can find them all over the country. Just a couple words of wisdom from some of our alumni. If you'd like to take a minute to read that. Another one of our SHU alumni. And just some closing thoughts. Our students at Sacred Heart Davis and Henley College of Nursing are prepared for today's healthcare market. That market is very different than it was 2 years ago or a year and a half ago, but we're prepared, and you're prepared for that. We prepare our students for NCLEX from day one with our exams that are taken in NCLEX style. We prepare you to be ready for that exam. And for practice. We have a supportive learning environment. We have rewarding clinical and global opportunities and a dedicated nursing faculty who are dedicated to the students of the Davis and Henley College of Nursing. And we, of course, have opportunities to pursue graduate nurse degrees if you choose to do that. So again, congratulations. I hope you choose SHU, and if you have any questions.
Thank you, Dr. Ferrillo. That was wonderful, a great overview. So at this time, it is your time to ask us some questions that you might have that are outstanding, and I will first introduce our panelists. First, Dr. Dean, our Dean of our Davis and Henley College of Nursing, Dr. Donius. We are also joined by our Associate Dean in the Davis and Henley College of Nursing, Dr. Sherry Watson. And you just heard from our program director, but Dr. Heather Ferrillo is also a panelist here this evening and is looking forward to answering your questions. So we have already received a few questions, tremendous questions that we will get to answering. First, Dr. Ferrillo, I'll have you answer this question. You talked a little bit about the NCLEX preparation. Some questions that have come through are, how exactly do you prepare for that exam?
So we prepare students from their first nursing class. All of our exams are given in the same NCLEX style on a computer, as similar you would take NCLEX. In addition, all of our questions are formatted and asked in the same way and developed in the same way that the NCLEX does. And so we prepare, and that's just one way we prepare you. We also prepare, a big part of NCLEX is critical thinking and clinical judgment, and we prepare you for that throughout the courses that you will be taking in nursing.
Wonderful. Dean Donius, along with the preparation on the NCLEX exam, there are a number of programs. Dr. Ferrillo explained in our presentation about graduate programs that we offer here at the institution. Can you go into a little bit more detail about opportunities once a student earns their RN license?
Yes, we have wonderful graduate programs. We have a master's degree in nursing that covers nurse educator, clinical nurse leader, and nurse exec. So a student who's out in the work world and sees opportunities for those areas of career pursuit, especially staff education and management in a clinical setting, we have that degree program. We also have a master's in nursing that leads to a family nurse practitioner certification. We also have a baccalaureate, post-baccalaureate FMP to DNP, which is a preferred degree now for many of the undergraduate students who see that they want to earn a clinical doctorate to advance their practice. And then finally, we have, for those who have been out a little bit longer and have earned a master's degree, a postmaster's DNP program as well. So in nursing education, what we're finding is the clinical specialty plus the advanced degrees are critical to having a variety of options for a lifelong career in nursing.
Wonderful. So there are a lot of opportunities for our students who join us in the class of 2025 to continue your education here at Sacred Heart University. Dr. Watson, sticking with clinical experience, a question came through about clinicals at the second year, the sophomore year. Does that mean in a hospital setting or just simulation experience?
Oh, that's a wonderful question. And in sophomore year, spring semester, we have you go into either an extended care facility. So it's at the clinical is more than a simulation. You're talking to patients, doing their health assessment, physical assessment, their basic care. So we have you do a local extended care facility for geriatric patients or an inpatient acute care hospital for their rehab units, their inpatient. And both of them is a couple of days, and then you move into junior year into more of a 1 day a week clinical. So
Wonderful. And a follow-up question regarding clinicals, Dr. Watson. It's where do the clinicals take place, which you addressed in your previous answer, but also how do students get there? So just a reminder, for those of you who are hoping to be residential students here in the fall, you won't have a car on campus freshman year, but you are able to have a car on campus beginning your sophomore year, which is when your clinicals take place. But can you just talk a little bit, Dr. Watson, about where those clinicals typically are and the driving distance from campus?
yes, so I should have mentioned in sophomore year, the extended care facilities are located very close to campus. One is directly across from campus, and one is actually near the Center for Healthcare Education, where the nursing program is running out of, all within walking distance. Then but junior and then there's a couple of the hospitals that you can get to, but junior and senior year our clinicals span I say like the Connecticut border of I-95, so we go up through to New Haven and down to Greenwich, up and down. And then we also have up to Danbury, if you know Connecticut, mostly 45 minutes to an hour the most. There is one that's a little bit further. It's up in Hartford. It's the Connecticut Children's Medical Center. That is because that's your pediatric rotation. We only have two major hospitals in Connecticut that do inpatient pediatrics. It's only a few days. It's not the full semester that you'll do an inpatient rotation. So it's between Yale or Connecticut Children's. Both amazing experiences. And I know that once the students say, oh, wait, let me go and see, the driving doesn't become a problem. We also note that you go with your group a lot of times. Those are the students who will be driving. They drive with a group, so it's not as bad as driving by yourself. We do take into consideration, we do ask, your preference. That doesn't mean that everyone gets a preference, but if you are a commuter student and you live 45 minutes away from campus, we'll take that into consideration if there is an opening. If we get the spot at Yale and you're closer up to that area than versus going down to Greenwich, we of course take that all into consideration.
Wonderful. Dr. Ferrillo, we have a great question that was just submitted, and that is, do you provide scrubs for students?
So you do need to wear scrubs to clinical, and you buy them at the bookstore. So yes, you have wonderful bright red scrubs that represent SHU, which everybody knows that you're from SHU when you're at the hospitals or in the clinical sites, and everybody else that's not a nursing major always wants the scrubs because they are so cool. So yes, you do get your SHU scrubs sophomore year. You will get those before you start because you'll be wearing them to labs and clinical, not to class, but to labs and clinical and simulation.
Wonderful. Dr. Ferrillo, another question for you. What is the required GPA in order to remain in the nursing program? And can you talk a little bit about the support services that we have in place here?
Sure. So yeah, you need to maintain a 2.8 GPA to stay in the nursing program. And there are a variety of support services from the university at the Learning Center offers a Student Success Center, which offers tutors. It offers classroom learning assistants. We have classroom learning assistants that work with us not only for like group study sessions, but also in the labs. We have a student success lab. So, student success lab is for students who would like or who have been identified to need a little bit of extra practice in some of the clinical skills. You can self-refer and go to and just go practice at the student success lab. There's often themed experiences in the student success lab where they may be doing some, say, come and practice IVs today. And so you can go and do that. So again, if you're feeling that you need some more extra practice, you can certainly do that. We also, faculty also have office hours every week. A lot of faculty have open office hours even online. You can just kind of pop in and ask some questions. You can have one-on-one with your faculty member. So we do provide a lot of support. And with the small class sizes, we're able to do that, provide that support.
Wonderful. Dean Donius, I'll preface this next question just a bit. We're known here at Sacred Heart just for our community engagement and interaction. And along with that comes a great deal of collaboration between yourself and fellow deans here at the institution. So a question came through is if a student begins the nursing program and just finds that nursing isn't for them, they rather shift to another major. What kind of services are in place and assistance to help that student find another major and make a transition to a different college here at Sacred Heart?
That's a wonderful question to have as a backup if you think you want nursing but aren't really sure. We have a fantastic arrangement with the College of Arts and Sciences, and one of their faculty members serves as an advisor for our students who are thinking of changing majors. They have an opportunity to meet with that advisor. That advisor understands what courses they've been taking and how they may fit into a different program of study. They also are very versed in oftentimes what nursing students leaving nursing really do find interesting. Sometimes it's psychology, sometimes it's sociology or social work, and sometimes it's just something like philosophy. And it's the advisement is very, very hands-on and very, very guiding. What we say is once you've joined nursing, you're always part of us. So a student who leaves nursing doesn't necessarily come back to us, but may want to come back at a different time for a second degree in nursing, so that our faculty are often asked for information or references as a result of that. But it's a very hands-on opportunity, and students from nursing, because they are so competitive, are welcomed in every other college on the campus. I'd just like to add one thing to what Dr. Ferrillo said about the support services. One of the things I like to encourage students and parents especially is that if you have received accommodations throughout your high school years in order for your success, you need to continue those in college. It doesn't mark you as less than, or it doesn't make you an outlier. What it does is provide the services that you need beyond what we provide in terms of tutoring support. So if you are someone who receives accommodations, please make sure that you see the Student Success Center and determine how you can continue those through your college years.
Thank you, Dean Donius. Dr. Watson, a question came through about clinical experiences and whether they operate on a rotation. So, are students sort of exposed to pediatrics, geriatrics? How does that work?
So with clinical, you graduate with a generalist degree, and that means that in America, that's across the nation. So your clinical does span from geriatrics to mental health, maternity, and pediatrics, adult nursing. You have 2 courses in that. You also have public health community nursing, and also the last is a capstone experience, that which could be what you choose, and you kind of match depending on your clinical abilities and what areas that we have, and we do a matching system there. So you do get across the lifespan, and also we do community through acute care hospitals. You'll do observations in the emergency department and critical care, outpatient dialysis, clinics outpatients, and with public health, I can say that since we're in the midst of a pandemic, our students live through public health and have done their clinical rotations, mostly all of them between testing clinics here at SHU and other testing clinics, as well as being vaccinators for COVID. So we couldn't have asked for a richer experience for our clinical for the public health, but we do community for outpatient and inpatient.
Thank you, Dr. Watson. Dr. Ferrillo, I'm going to stick with you for the next couple questions that just came through. First, there's a question about just a general factor of about how many hours per day do nursing students study with their classes?
Oh boy. Well, I think it depends on the student, but it's definitely an everyday studying. And as you get farther along in the program, it's a little bit more. And if you do study every day, then you do better because you are immersing yourself in that. So, is there a lot of studying involved? Yes. But is it manageable with other activities? Yes. We have most of our students are not just nursing majors. They are able to balance, again, D1 athletes that go in tournaments and practices and games and able to balance it. So it is definitely doable, but you do need to study every day.
Wonderful. You actually answered the second part of that, which was, are you able to get involved in other campus activities? Which the answer is yes. Our nursing students are actively involved on campus and community service with the greater community as well. So another part of that question, Dr. Ferrillo, is regarding the honors program. Many of our nursing candidates, because of your academic credentials coming into college with your college applications, were offered seats in our honors program. So can you talk a little bit about the balance of workload with the honors program?
So yes, we have a lot of students that are in the honors program that are in nursing, and they balance that very very well with the courses that are required, and with their capstone that we can sometimes integrate into their nursing capstone. And so it's actually a very nice balance between the honors program and nursing, and you'll find a lot of other nursing students, if you decide to do honors, that are there with you.
Okay, and one more question for you, Dr. Ferrillo. Are nursing students able to add a minor? And the question specifically is regarding a minor in Spanish.
That's a great question. So we do have many students that add a minor. We do have some room in the plan of study with your electives, as well as some of your core that can kind of you can use as part of your minor. So Spanish is one that is pretty popular. Psychology is another one that's pretty popular. We have students that do minors in management and business. We have students that do minors in nutrition. So there are a variety, sociology. There are a variety of minors that you can definitely integrate into your plan of study.
Wonderful. Dr. Watson, a question for you regarding our nursing class format, the modality of the classes. Are they all fully on in person or any online at all?
So our classes, you have to be on campus. So let me start with all of our labs are on ground and our simulation. Clinical is obviously in there. So the actual lecture part we have on ground, and then there are several classes, about one per semester, starting in your spring semester, sophomore year, that will be a blended format. So what that will be is that you meet 1 week because we're block classes, and then the second week could be asynchronous online. There are times that could be that you meet for, because it's a 3-hour class, let's say, you would have 90 minutes. You come in for that week, and then you'll have a 90-minute assignment that's asynchronous that you could do anytime for that week. So we call those blended. So you're not meeting every single week, but there's only a few of those. Basically, as I said, one class per semester starting your spring sophomore year. And but however, if any of those classes that you do take require a test, those will always be given on ground.
Wonderful. I'm going to read this next question verbatim. It's a good one, and I know that it can differ from institution to institution based on where you've submitted applications to. Dr. Ferrillo, since we have already been admitted to the nursing program at Sacred Heart University, but we don't start our nursing courses until our sophomore year, do we need to reapply in our sophomore year, or do we just maintain the GPA and complete our prerequisites?
That is an excellent question. So you are admitted to the College of Nursing. That is your seat, and you do not need to reapply as long as you maintain the requirements for your freshman year classes. Then that is your seat to continue in as a sophomore. It is true that there are some other schools make you reapply, but we do not, and that's why we say that if you are interested in nursing, even if you think you may not be interested in nursing, but you might be interested in nursing, join the nursing major, because you can't transfer in, but you can very easily transfer out if you decide that you don't like nursing or it's not for you. So that's definitely a plus, is that you do maintain your GPA and you pass the classes, and that you are in the nursing program from day one.
Thank you, Dr. Ferrillo. Next question is about freshman advising and even the freshman transition. So I'll start to address the freshman transition. Here at Sacred Heart, we have had in place a very successful program called the First Year Experience, and I'm actually a proud instructor in the First Year Experience program. It's an 8-week program that you will begin when you arrive here on campus, and it's taught by a staff member along with your orientation leader will stay with you, which is a current student here at Sacred Heart. And the class covers a number of topics such as time management, stress management, but in particular, we make sure that you are fully aware of the resources available to you here at Sacred Heart University. We've mentioned many of them just in terms of our Student Success Center, but even our writing lab, our math lab, tutoring services, classroom learning assistance. So we make sure that you have a full awareness of all that we have to offer here to help you with your transition, because it is a big transition to come to college. But in terms of the advising process, Dr. Ferrillo, I'll toss it over to you to talk a little bit about freshman year advisement.
So freshman year advisement, as I had mentioned before, is we have dedicated freshman advisors, and those advisors are really attuned to the needs of the freshmen. So you'll have opportunities to meet with them as a group. You'll have opportunities to meet one-on-one. You'll even meet with your advisors at your orientation in June. So then you have that opportunity to build that relationship with your advisor. And again, they can help you to make that transition not only into nursing, but into the university, because they are aware of all of the resources that are available for you to take, to use during that time. Once you transition into your sophomore year, then you are assigned another nursing faculty member that will be your advisor for the rest of your time at Sacred Heart. And they will advise you through the transition of junior year, senior year, and even into practice. We keep in touch with our advisees after they graduate, help them to secure jobs, to prepare for NCLEX, and just to see how they're doing. And sometimes even after, I still get phone calls and emails several years after from my advisees, asking for some career advice or even a reference. So we have a pretty strong advisement program in the College of Nursing, and again, all of the advisors are faculty.
Wonderful. Dr. Watson, a question about number of hours that students participate in clinicals throughout the program.
So we have a little bit over half of our credit hours is calculated to clinical. So it's a little over 525 hours of clinical for across the program starting sophomore year. And that's in addition, that's just clinical. That is not the lab. So that helps.
Perfect. Dean Donius, I'll start with you. The question came in: what happens after we graduate? Is the degree that we receive for a general nurse, but then also sort of what are the next steps that we provide our graduates?
Well, I think Dr. Ferrillo alluded to it, that our advisors are very instrumental in guiding our senior students as well as the faculty that teach the students. And I'll defer to Dr. Watson, who does that and does it very well. But because our faculty are all in practice at some level, they know the industry very, very well. They know their students. They're able to guide them in terms of the areas of practice that they might like to try. One of the things that's been very helpful for our students are some of the nurse residency programs that are starting up among many of the academic medical centers throughout the country. And our students have been very successful in obtaining those nurse residencies. I like to say that once an academic medical center has one of our students, it makes it so much easier for the ones that come behind, because they know the quality of the student, and every other student who applies is usually accepted as a result. The other piece is that oftentimes our graduates have already set their sights on some career path, like an advanced practice role in nursing. And our faculty are very helpful in guiding those students to what they need to do in order to apply to the next level of education, particularly as an advanced practice nurse. We recognize that in our own students, and we have a program where we, for the top, I think, 15%, we offer admission to our FNP DNP program at the senior year, and students have 3 years to opt on that acceptance if they so choose. So I think with our guidance from our faculty advisors, from the nurses that they have in class, and from the opportunities that present themselves because of our reputation of the program and our student outcomes, they have very, very good opportunities and guidance.
Thank you, Dean Donius. Dr. Watson, a question about orientation. Is there a specific orientation for the College of Nursing admitted students, or is that part of our university welcome orientation program?
That's a great question. So in June, you'll meet. So part of your orientation in June is nursing, and you'll meet with your academic advisor, and we go over, we call it like the nuts and bolts of nursing. And then in August, you'll have another time with your nursing major, nursing advisors. And we also have Student Nurse Association, we call them the SNA, and all nursing students are part of it. Freshmen can join for free, and then afterwards the dues are actually rolled in. And they also hold special orientations for nursing majors. The SNA, they have a peer mentor, we'll call it peer mentor, but it's really the for the freshmen, the upperclassmen, they want to do this. They volunteer the upperclassmen, and they get to meet up with a small group. And so you have that opportunity for orientation. And so that part is an orientation. And in the first few weeks, we have the students, the upperclassmen, put on an orientation of how to manage anatomy and physiology, how best to approach chemistry, a little bit more about time management. They have an ice cream social. So then we also each year at the end in the spring semester, we meet. Actually, Dr. Frillo and I will meet again. We did a beginning of the semester, end of the semester, and we talk about what's next. So during your advisement, you hear about your classes, and at the end of the semester, we talk about health compliance and, what are you looking forward to? Don't forget to do this over the summer or that. So yes, you'll have an orientation for the university and the College of Nursing, but then each semester or at the end of each year, at least in the spring, you'll have us talking to you again about looking forward. So it's an ongoing orientation because we know that each year a little bit different, and so to try to retain that for 4 years is a lot. So.
Wonderful. A few more questions for you, Dr. Watson. First, the blended course format, was that just a format that began because of the pandemic, or did the College of Nursing always offer a sort of blended opportunity for learning?
Oh, so great question. Again, so the blended format started several years ago. We had listened to our students and they had asked for a little bit more flexibility with their schedule. And so we looked at which courses would match that. And so, like nursing leadership, of course, I teach, is a blended course and it lent itself to that. So we have an asynchronous format for 1 week and then we bring them back into the classroom for another week. So we started that several years ago and actually worked out fantastic for the pandemic when we've already been teaching online, so we really didn't miss a beat. We actually we flipped our classes within hours, because we all teach in that blended format, so we knew how to teach online as well.
Wonderful. And then one more question, Dr. Watson. Are there summer internships that are required as part of the program?
So summer internships, we do not require anything for our program. However, there are several summer intern or extern, depending on the hospital or the setting, and they send them to us and we post them. So we always encourage between junior and senior year to have to be hired. And we will write lots of letters of recommendation, or your faculty will, but it's not a requirement, it's encouraged, and we do post them. So the students will have lots of opportunities to see what is available to them.
Wonderful. Dean Donius, I'll ask this question of you, and I know you've answered it, but for folks who came in a little bit later, are faculty still active in the nursing field?
Oh, yes. That's one of the wonderful pieces of our faculty. They all have some aspect of practice outside the classroom. It makes them current. It makes them relevant to the student who is in the clinical experience for the first time, or even to the senior year. They have their stories that they can elaborate and develop their points for the students. They connect really well with our students because of that experience. But they're also highly skilled educators. One of the things I'm most amazed about our faculty is the ingenuity they have in creating learning experiences in the classroom. They don't lecture, and I think sometimes students wish they would because they could fall asleep. But they may present a few slides and principles, but once they do once the faculty present some of the concepts, then the active engagement begins in the classroom. So it's a very dynamic way to learn from seasoned educators and seasoned clinicians.
Thank you, Dean Donius. We were all too still. The lights, we weren't moving enough for the lights to stay on. We fixed it. Okay. Dr. Ferrillo, a few questions have come through about the number of graduates in the program. Now, our incoming nurse class sizes have varied over the years. But can you talk a little bit about the number of graduates this year and just the overall retention in the nursing program?
Great. So, as you said, Pam, that the numbers have varied. We have increased over the last several years. We have, I believe, 156 graduates this year, which probably approximately the same for next year. And as far as retention goes, there's a number of reasons that students may, choose or not move on in the nursing program. Again, we encourage students to pick nursing if they think they want nursing because you can't transfer in. So sometimes students as a freshman may decide that this is not for them, and so they move to another major that they like better, or they decide that the workload is not what they like, or sometimes they're not able to be successful. So really our biggest attrition rate is in freshman year, again, because of all of those reasons. And then as we go through each year, there's most of this, the vast majority of students move on to the next year. And are successful in graduating. So really, the numbers, you could look at a number of how many students start and how many finish, but there are a lot of factors that go into why that happens. And so,
Wonderful. Thank you, Dr. Ferrillo. Very good question. I know we're in our last 9 minutes or so of our program this evening. There's been tremendous questions that have come through, but this is a really good one for all of our prospective incoming freshmen. It is, and I'll ask Dr. Watson, maybe you can provide some input. What can I do to prepare for the nursing degree, even over the summer, before I get going in the program this fall?
Oh, okay. That's a hard one. Thanks for giving that one to me.
Sorry, Dr.
That could have gone to Dr. Frillo or Dean Donius. That's an excellent question. And what can you do? I think I think the biggest thing would be to be time management and to be organized. And so, what does that mean for you? So, there's probably a few things that I think you can do. One is, and I say this because everyone eventually gets one, is a planner. Realize what type of student you are. Do a little self reflection. Understand self care. I think is also another way. Is start planning ahead. What are the things that you like? What are the things that you should continue to do to maintain yourself healthy? If you were successful in high school and you need some time alone, or you need to meditate, you need to go take a walk. Those are the things that you should remember if you have to write them down. Those were the things that I would say: time management and reflect on how to be healthy and self-care, because once you start having a lot more responsibilities here and your course load, that would be a problem. If you can take, there are some pre-fall programs here, and I think that's a great way to meet other people, get more acclimated to the university. I know nursing has a pre-fall. It's on our website, and there's other pre-falls out there as well. And it's a week before you come to, so you would move back to campus a week before. So in August, whatever that date is, you back it up by a week. And I would encourage you to do that. That would give you a leg up to getting to know the university better, and getting to know some of your peers. The other thing is, Dean Donius had mentioned this, and I would strongly encourage, if you've had any accommodations in high school, that you would meet with our JLC Student Success Center and get them in place. It is all worthwhile. You don't have to enact on it, but we cannot provide that service unless you've already gotten approved. So mid-semester, you might want it. So if it's already approved, it's as easy as telling your faculty member, I need this. So I would take the time this summer to definitely do that as well. So those would be my 3 things that I think that you should do.
Tremendous advice. I certainly am not a nurse. I admire my nursing colleagues, and I certainly admire all of you for pursuing such a heroic field. But I know that as I've progressed in my own career, a planner is my favorite tool that helps to keep me organized. So I strongly recommend that. Speaking of tools, Dr. Ferrillo, another question is: are students provided a stethoscope, or do they have to buy their own?
So students in their sophomore year are going to need their stethoscope, and we do not provide them, but we do provide you with the means to order the stethoscope of your choice. They're a little bit, everybody likes it in a little different color, a little different style that works for them, a little bit length. So we do provide you at the end of your freshman year with that. With the link, you can buy it wherever you like, but with a link to buy it from one of our providers, and you can buy your stethoscope at that point.
Wonderful. Dr. Watson, in terms of clinical experiences for our students, are there any vaccination requirements that students have to provide proof of?
Yes, they are. So actually, it depends on also if you live here on campus. They're very similar, but our students, you get a whole health clearance packet, and you have to have an annual physical. And we also require, and some of these are very similar, like all the hepatitis and meningitis, and I'm trying to think, the regular childhood immunizations that you all, vaccinations that you would all require. We also, once you start clinical, so that would be your sophomore year, all the places that we work with do require our students to have a flu vaccine. And if you have a flu vaccine, if you are allergic to the flu vaccine, you have to prove it with a letter. And then there's all these things that you have to go through, which if you're allergic, that happens. And we realize that because we have a contract with our clinical providers. So that's the reason why some of these things. We also, if someone's asking about the COVID vaccine right now, we are not requiring that because our community partners don't require that. Once that happens, that's something else that we'll work with. We do have 2 extended care facility placements that have just started talking to us about requiring our students to have that. So we haven't made any movement towards that yet, because the vaccine is still new in the sense of getting it rolled out. So we're very fortunate in Connecticut, and I say that contributed because our students have been vaccinating. So that's been helping us be moving forward and leading the nation with our vaccines. We also, beyond the vaccines, we also require 3 drug tests, junior and senior year, and criminal background checks every year, starting in your sophomore year. And the reason why, and I just will put that out there now, is not because of us, but because of our community partners. If they require it, we have to do it. In order for you to go to clinical. So those requirements are all up front. They're also, posted everywhere. But I hope that answers your question about the vaccines, if it was specifically also about COVID too.
It was not specifically
Oh.
COVID, so you answered it very thoroughly.
Okay.
Thank you. Thank you, Dr. Watson. Okay, as we enter our last few minutes, a few questions have come through, and I'm going to open it up to our panel. But Dean Donius, I'll start with you, just to discuss. And I know Dr. Ferrillo highlighted this in her presentation about what separates Sacred Heart's nursing program from other programs. But you've led this college for many years now, and it's grown under your leadership. So I'll toss the question over to you to start.
Well, I think the first thing is that we do have a unique definition of nursing. Every nursing program has to have a caring curriculum. It's a requirement of our accreditors. But the Davis and Henley College of Nursing has a specific definition that nursing is caring with compassion, meaning the heart, empathy, meaning an understanding, and altruism, which are the actions and the skills that our nursing students and nurses take. The intention of compassion, empathy, and altruism is for healing, and that healing is body, mind, spirit, and that is so consistent with the mission of the university. I think that's one of the things that I value most about being the dean here, is that the College of Nursing is fully vested in the mission of the university, and the university is fully vested in the mission of nursing. It's a real partnership, and it's a hand-in-hand movement of the students through the programs and through the university itself. So it does make us unique, I believe.
Wonderful.
The other is our faculty. We have an outstanding group of men and women in our faculty. They're young, they're vibrant, they're energetic, they're practitioners, they're advocates. They're role models at every level for our students. I can't say enough about them. And the vibrancy they bring to nursing, and the passion they bring, and the love they have for their profession, and their dedication to our students. I would say those 2 things are the level at which those 2 things exist here are extraordinary.
Wonderful. Dr. Watson?
So I completely agree with Dean Donius. And the 3 things, I'm just going to say them very fast. One is our students and their professionalism and dedication to doing a good job. We receive compliments across the management, across the clinical experiences, and our students are genuine. They're caring. They open our doors. It's a very nice community at Sacred Heart, but then also at nursing, it extends into the clinical practice field, and our students are professional and they work hard. So I think that, and that has been known
Mhm.
for a very long time with our reputation. The other two unique things is our faculty care, and we spend, but I think it's the unique to SHU in the way that it's we have a SHU touch, we call it around here, and we hate to see it ever go. And is that because there's a connection between faculty and students? Even if we get larger in our program, we still connect with our
Mhm.
students. I might not be able to connect with all the students because I'm not teaching them, but in my classroom I have lots of one-to-ones. I know where they are. If they're not coming to class, they let us know. We connect if they're having trouble. And our students, students do communicate with us, and we do want to know where you are, like, because of course we're nurses and we care. But on top of it, it's that connection that we build with our students, that I think that, and it's not just nursing students, it's just nursing faculty. We have a student, that's in trouble in psychology, and they'll call us up and they say something's going on with that student. So we do communicate to make sure our students are doing well. And so that's the SHU way, I call it. And then the last part is unique in our programming, is I think I have to say, is our global programs, study abroad, and our global clinical placements. And the reason why I say that is the students requested that years ago. We've been having this now for 11 years, is our programs, and we're innovative. And so instead of saying, no, we can't do it, if a student says, what about this? We will look into it and we'll do everything we can to make it happen. So I think it's that innovation that is something that I say that we're unique about.
Dr. Farillo?
Oh, sure. So I'm last, and everybody took all of my answers already. So I'm just going to reiterate that I think the thing for me that is the most unique, and not necessarily unique, but important, is that faculty-student connection, and that we care about students, students care about the faculty, and having that ability because of, again, the small size, and because faculty want to be connected. Faculty that come to SHU know that that is one of the things that we are known for and that we value, is that student connection, and they want to know their students, and we work hard to know our students, and we're so excited that in the fall, hopefully, we can have them back in our offices, so that we can make that that connection, because it is very important, for your growth and for your journey to being a nurse.
Wonderful. I know we went a couple minutes over time, but I think those answers to your last question sort of portray the passion that we have here at Sacred Heart, and how proud we are to have you all interested as you are, and as admitted students to the class of 2025 here at Sacred Heart University for our Davis and Henley College of Nursing. It's been a pleasure sharing the last hour or so with all of you. I hope we got a chance to answer many of your questions. Certainly, my staff, our team in undergraduate admissions, we are available if you have any additional questions as you make your decision for your deposit deadline on May 1st. And we certainly hope you consider Sacred Heart. If you haven't had an opportunity to visit us on campus yet, we have a number of opportunities left with availability. Please do check sacredheart.edu/visit planner to plan your visit. And if you have any questions or need help registering for an upcoming event on campus, please just give us a call and we'll help you through that process. Thank you again. Congratulations, class of 2025, and we hope to talk to you soon. Have a good night.